So guys, in this last part of the neuroanatomy, let us now talk about the blood supply of the brain. So we'll take care of the circle of Willis. We'll talk in detail about the blood supply for the internal capsule. And then we'll also take the three major arteries in detail. That is the vertebral artery, the basilar and internal carotid. So let us start with the blood supply part. So in the blood supply, as we said, we'll first begin with the blood supply of internal capsule. So may I suggest you to draw the internal capsule very much on the left side of the page, so that on the right side we can draw the circle of Willis and can see what arteries are supplying it mainly. So going with the same diagram that we are discussing till now for the internal capsule, here's the anterior limb. That's the genu, the posterior limb. We got this retrolentiform part, and let us imagine this is a sublentiform part here. Anterior limb, genu, posterior limb. R is for the retrolentiform, and S, let us say, stands for the sublentiform part. Well, regarding the arteries which are forming the circle of Willis, first of all, starting with the posterior circulation, let's say these are the two vertebral arteries which are joining to form the basilar artery. That is a vertebral artery here. And that's the basilar artery which is formed by the junction of the vertebral artery. And we also know that basilar artery divides into these two terminal branches. So we have vertebral artery. I'm writing in short here. Try to write it on the right side. These are basilar artery, and they are dividing into posterior cerebral artery, the two terminal branches of basilar. That is a posterior circulation. Whereas in the anterior circulation, obviously it is by the internal carotid. So let's say this is the internal carotid artery, giving off posterior communicating artery which is connected to the posterior cerebral. The main continuation of internal carotid is the middle cerebral. Another direct branch from internal carotid is the anterior cerebral, which is connected by the anterior communicating artery. And we also have another direct branch from internal carotid called as anterior choroidal artery. Let me label them. This is internal carotid. This here is middle cerebral. That is anterior cerebral artery. This is the anterior communicating artery. That is anterior communicating artery. This obviously is the posterior communicating artery. Whereas this direct branch here is called as anterior choroidal artery. This also is direct branch from internal carotid called as anterior choroidal. Posterior choroidal is a direct branch of PCA that comes from the posterior cerebral artery, that is posterior choroidal. Now guys, the first thing before we go to the blood supply to internal capsule, that which arteries amongst all these are actually forming the circle of Willis. Now when you say the circle of Willis, you have to count the arteries which are actually in that circle. So the arteries which are contributing to this circle here. And for that matter, it's the anterior communicating artery, number 1. Anterior cerebral artery, number 2. Internal carotid artery, of course. Posterior communicating artery and posterior cerebral artery are the one which are forming the circle of Willis. Not middle cerebral and not anterior choroidal. So it's anterior communicating, anterior cerebral, internal carotid. Then we have posterior communicating and posterior cerebral. These are the arteries which are contributing to the circle of Willis. So before going to these major branches, let us first talk about the arteries which are supplying the internal capsule. Now from the anterior cerebral, guys, from the anterior cerebral just proximal to anterior communicating artery, there is a branch which comes back and supplies anterior limb and genu. This artery which comes back and supplies the anterior limb genu, this actually goes through the anterior perforating substance. Remember we said anterior perforating substance is the one which gives passage to the branches of anterior cerebral and middle cerebral. So that's the anterior perforating substance it goes through. This artery is called as recurrent artery of Hubner. This is the recurrent artery of Hubner. So that's a branch of what? Anterior cerebral artery. Where it originates? Just proximal to anterior communicating. It goes through the anterior perforating substance and supplies the anterior limb and the genu part, called as recurrent artery of Hubner. Similarly, middle cerebral artery. There are numerous striate branches or the direct branches coming from middle cerebral artery supplying the internal capsule. And out of those, the one which I'm more concerned about right now is the artery called as Charcot's artery. This artery is called as Charcot's artery, also called as lenticulostriate artery. Please note that this is called as the Charcot's artery or lenticulostriate artery. Then we have this anterior choroidal artery. It's a fine branch which is supplying the posterior part of posterior limb and sublentiform part. That is the anterior choroidal artery. That is anterior choroidal artery, which is supplying the posterior part of the posterior limb and sublentiform part. So guys, this anterior choroidal artery, which is also a direct branch from the internal carotid, this is the one supplying the posterior part of posterior limb and sublentiform part. Now see, this is a direct branch from internal carotid. Internal carotid is a direct branch or direct continuation of the common carotid. So we said if the thrombus goes into the common carotid artery, the chances of the thrombus traveling in the internal carotid artery is more when compared to the external carotid. And then from there, it can go into the branch like middle cerebral artery. Middle cerebral artery is the main continuation there. Anterior choroidal artery being a direct branch of this internal carotid, moreover, it's a long artery with a narrow lumen. And that is why it is easily occluded by the thrombus. That is the reason this anterior choroidal artery is also called as artery of cerebral thrombosis. We call it artery of cerebral thrombosis, that is anterior choroidal artery. Please note, it's a long artery having a narrow lumen. So we call it artery of cerebral thrombosis. Then we got the numerous branches from posterior cerebral artery supplying sublentiform part, retrolentiform part, and some branches also supplies the posterior limb. Now this is a schematic diagram just to show here. It also supplies the posterior limb. So these are the branches coming from posterior cerebral artery taking care of the retrolentiform, sublentiform part as well as the posterior limb. Now one of the questions which I remember from this is that which of the following artery is not supplying the posterior limb? And I hope you remember that why posterior limb is so important, because posterior limb was having the pyramidal tract, the corticospinal tract was there in the posterior limb, and that is why the blood supply is immensely important here. So if you talk about the major branches, the options were arranged something like this. Which of the following arteries not supplying the posterior limb? The options were anterior cerebral, middle cerebral, posterior cerebral, or anterior choroidal artery. So as you can see, anterior choroidal supplies it, middle cerebral supplies it by numerous branches including the Charcot's artery. It is also supplied by the posterior cerebral. It's the anterior choroidal which is the answer, which doesn't supply the posterior limb of internal capsule. That's why in case of the anterior cerebral artery stroke, the corticospinal tract is the one which is not affected because it is in the posterior limb. So guys, this is about the blood supply of the internal capsule and the branches from the circle of Willis. Now let us also talk about these arteries in a bit more of detail. We'll talk about the vertebral artery, the basilar artery, and also about the internal carotid artery branches, the different parts of the internal carotid. So let me start with the vertebral artery first. Okay. In case of vertebral artery, we have four parts of vertebral artery. The first part of vertebral artery is the one which you see from the origin, that is from the subclavian artery, till it reaches the foramen transversarum. origin to the foramen transversarium. Origin to the foramen transversarium. Second part of vertebral artery is the one which is within foramen transversarium. The one when it runs into the foramen transversarium of upper 6 cervical vertebrae. That is the second part. Third part is the one which is from foramen transversarium of C1, when it comes out of the foramen transversarium of C1 and reaches till the foramen magnum. From the foramen transversarium of C1 to the foramen magnum. Whereas the fourth part of vertebral artery is the one which is present above foramen magnum, or you can say it's an intracranial part, the one which is inside the cranial cavity. So these are the four parts of the vertebral artery: till the foramen transversarium, within foramen transversarium, then from the transversarium to the magnum, and then above the magnum. Now let me put this thing diagrammatically first, and then I'll tell you one question which was asked last year. It's a wonderful question asked in the AIIMS exam. Okay, so we said if this here, let's say, is the subclavian artery, and that is the first part of subclavian artery. This is the first part of the subclavian artery. Well, you know, the vertebral artery is from the first part of subclavian, VIT, the 3 branches. So this vertebral artery coming from the first part of the subclavian, you will see it ascending within foramen transversarium, that is 2, 3, 4, 5 and 6. So it is from the C1 to C6 foramen transversarium and not the 7th. Foramen transversarium of the 7th cervical vertebrae is not giving passage to the vertebral artery, although it gives passage to the vertebral vein. Vertebral vein can pass through it, but not the artery. And then this vertebral artery, it enters into the foramen magnum, to goes into the cranial cavity. That's how the 4 parts are divided. This is the first part from the origin to the transversarium. Within the transversarium, this obviously is the second part. Between the magnum and the transversarium, that is the third part. And this which is inside the cranial cavity, that is intracranial part, or the fourth part, which is going into the posterior cranial fossa. Coming to the question which I was talking about, which was asked in the recent AIIMS exam only, it was a very nice question. I mean, many people got confused by and answered it wrongly, because what they did in the question, they gave the first cervical vertebrae. They gave a superior view of the first cervical vertebrae. Now let us say, guys, this is the atlas vertebrae, the first cervical vertebrae. And we know atlas vertebrae is the one which is not having a body. So we have these transverse process. We have the bifid spinous process. And we got an anterior and the posterior arch of the atlas. And obviously the foramen transversarium. That's roughly how the first cervical vertebrae or the C1 vertebrae will look like. Now what they did, they put an arrow in the different part of the vertebrae, and question asked was that third part of vertebral artery will be seen where? If people who read the question as that vertebral artery is seen where, many of them, they went with the foramen transversarium. But the question was specifically about the third part of vertebral artery. So vertebral artery, once it comes out of the foramen transversarium, it runs on the posterior arch of the atlas, and then it enters into the foramen magnum. That means inside the foramen transversarium, we have the second part of vertebral artery. And the third part of vertebral artery is not in the foramen transversarium. It is present on what? It is present on the posterior arch of atlas. It is on the posterior arch of atlas where you will appreciate the third part of vertebral artery. In fact, to tell you more here, that when the vertebral artery comes out, goes like this from the just above this posterior arch of the atlas, there is one more structure that you will see here, and that is the C1 nerve. So that could be a future question as well, that what are the structures which are running on the posterior arch of the atlas. So we have a third part of vertebral artery, and the C1 nerve can be seen coming out here. C1 nerve will come out between the foramen magnum and C1 vertebrae. So that's the C1 nerve that you can see there. Now, regarding the branches of the vertebral artery, the first part of vertebral artery, it only gives off the muscular branches. It gives off muscular branches supplying the muscles in the neck region. Second part gives off spinal branches supplying the spinal branches. Third part, again, because third part of vertebral artery is present in the suboccipital triangle. Mind it, not occipital, suboccipital, the one which is behind. So it is also giving off the muscular branches in that part. And then majority of the important branches, the main branches are coming from the fourth part of the vertebral artery. And those branches which are coming from the fourth part, I'm sure you all know these branches, that is the anterior spinal arteries. We got posterior spinal artery. We got this one very, very important branch, that is spica, posterior inferior cerebellar artery. We read about this artery in the Wallenberg syndrome, the posterior inferior cerebellar artery. Then we got direct branches supplying the medulla, so we simply call it medullary branches. And let me write it here. We also have meningeal branches supplying the dura mater of posterior cranial fossa. Something we discussed in the head and neck, that the dura mater of posterior cranial fossa is also supplied by the vertebral artery. So we got the meningeal branch, we got anterior spinal, we have posterior spinal, this very, very important, the posterior inferior cerebellar artery, and also the medullary branches, which are supplying which is giving the direct branches to the medulla oblongata. So they are the branches from the fourth part of the vertebral artery. So guys, after vertebral, now let's move on to the next major artery, and that is basilar. Let's talk about the basilar artery here. The basilar artery. Let's go diagrammatically in that also. So taking you back to the brainstem ventral aspect, where we said if this here is the pons, so we got the two vertebral artery which will meet and form this basilar here, basilar on the ventral aspect of the pons. And then this basilar artery, it divides into these two terminal branches. One of them is these terminal branches, that is a posterior cerebral artery. Let me just make it a bit clear by highlighting this part. This is the pons part, right? So you can see the arteries running on the pons, on the ventral aspect of pons. Here is the vertebral. These are the terminal branch, that is posterior cerebral artery, which was running on the ventral aspect of the cerebral peduncle. Then another branch that you see that also is in the upper part only, and that is the superior cerebellar artery. This is superior cerebellar artery, that is superior cerebellar artery. Remember the superior cerebellar artery and posterior cerebral artery, the two nerves which were emerging between the two? That is a third nerve and the fourth nerve. The third and the fourth, the oculomotor and the trochlear nerve, are the one which are emerging between these two arteries. We discussed that in the cranial nerves. Now, apart from posterior cerebral and superior cerebellar, what other arteries we have in here? We got numerous direct branches supplying the pons. We simply call them pontine branches. And then we have another major branch that is seen in the lower part. This is called as the anterior inferior cerebellar artery. These are the direct pontine branches or the pontine arteries. And this important artery is ICA, anterior inferior cerebellar artery. So guys, posterior cerebral, superior cerebellar, numerous pontine branches supplying the ventral aspect of pons, and anterior inferior cerebellar artery. I'm sure you must have read about one more artery which may come from Basilar, that is the labyrinthine artery. But if the question is asked, labyrinthine artery is a branch of, the better answer is anterior inferior cerebellar. So labyrinthine artery is given off from the anterior inferior cerebellar. So labyrinthine artery, as I said, anterior inferior cerebellar artery is a better answer than the basilar artery. If it is not coming from anterior inferior cerebellar, then it may come from the basilar artery directly also, but usually from AICA. So these are the branches which are coming out from the basilar artery. The terminal branch is PCA. Now, you just remember the branches where they are located, and you still will be able to do certain questions on this. Like, let me remind you of one question. The question asked was that which of the following artery is not supplying the spinal cord? Listen to the question again. Which of the following artery is not supplying the spinal cord? Options were anterior spinal, posterior spinal, it was basilar artery, or superior cerebellar artery. Now, vertebral artery gives off anterior spinal and posterior spinal. So they both are running in front and behind the medulla oblongata. They supplies it. Anterior spinal as well as posterior spinal. Both the vertebral artery, they form the basilar artery. So the upper part of the medulla oblongata is also supplied by the direct branch of the basilar artery as well. But superior cerebellar artery is far off. You can see superior cerebellar artery is in the upper part. It's far away from the medulla oblongata. So obviously it's a superior cerebellar artery which is not supplying the medulla oblongata. The kind of question on which, even if you have not read about it directly, just by knowing that where those arteries are located, you can still answer those questions. And now finally coming to the third major artery, that is internal carotid. The third and the last, the internal carotid artery. Internal carotid artery. Okay. In the internal carotid artery, guys, again we have four parts. The first part is present in the neck region, so we call it the cervical part. Second part is the one which actually goes in the petrous part of the temporal bone. Remember that one goes into the, when we talked about the foramen lacerum, it goes into the carotid canal and foramen lacerum. So we call it petrous part. Then once the internal carotid artery clears the foramen lacerum, it obviously goes into what? Cavernous sinus. Cavernous sinus is resting on foramen lacerum. So as soon as it goes in, it goes into the cavernous sinus. So third part is the cavernous part. And the fourth part of internal carotid artery is called as the cerebral part. The one which is inside the cranial cavity supplying the cerebrum. CPCC, four parts. CPCC, cervical part, petrous part, cavernous part, and then we have the cerebral part. Let us understand these four parts. So imagine if this here is the cavernous sinus. If this is the cavernous sinus, which we said is resting on the foramen lacerum, let's say this is the foramen lacerum here, which is also having this carotid canal in. So here's the cavernous sinus. Floor of the cavernous sinus is by the foramen lacerum. This is cavernous sinus. This is foramen lacerum. So the internal carotid artery, what it is doing, it is coming from the neck region, that is the cervical part. It goes into this petrous part of the temporal bone in the cavernous sinus. In the cavernous sinus, it makes this loop, and then it goes above the cavernous sinus like this. That is the fourth part. And I hope you also remember this portion, this bend of the internal carotid artery is also called as the carotid siphon. This is also called as the carotid siphon, which is to dampen the pulsation of internal carotid. So this is the first part, that is the cervical part inside the carotid sheath. Obviously, this is the one which is covered with the carotid sheath. Carotid sheath extends till the base of the skull. We got the second part which is in the bone, that is in the petrous part of temporal bone. Third part, intracavernous part or the cavernous part, and this is the fourth part which is running above the cavernous sinus, forming the roof of the cavernous sinus and also supplying, giving off all the major branches supplying the cerebral hemisphere. Now when it comes to branches, the first part will give off no branches. There are no branches coming from the first part of internal carotid. As we said, internal carotid and common carotid, they are inside the carotid sheath. So no branches. Branches are only for the external carotid. When it comes inside the petrous part of temporal bone, it just gives off the branches to the surrounding bones only. So we call them bony branches, right? We have osseous branches or the bony branches. Third part, now this is important. Third part of the internal carotid artery, that is the one which is inside the cavernous sinus, gives off some direct branches. One of them is the one which supplies the pituitary gland, that is the superior and inferior hypophyseal arteries. Superior and inferior hypophyseal arteries. Then it also gives off the artery to supply the sphenoidal air sinus. See, whatever is there in the medial relation of cavernous sinus, they're all supplied by it. So it is also giving off the artery to sphenoidal air sinus. Artery to the sphenoidal air sinus. And it is also giving off the meningeal branches. Internal carotid artery, it gives off the meningeal branches to supply the dura of middle cranial fossa. This is also we discussed in the dura mater. The dura mater of middle cranial fossa is supplied by the branches of the internal carotid, and that is more specifically from the third part of internal carotid. And guys, then finally we have the fourth part, the part which we already know about, the part which contributes to the circle of Willis. So in the fourth part of internal carotid, for which I'll show you the picture also after that, the fourth part of internal carotid artery is contributing to circle of Willis, but the question here is that what is the first branch of internal carotid as soon as it comes out of the cavernous sinus? So when the internal carotid artery emerges out of cavernous sinus, the very first branch it gives is the ophthalmic artery. That is a question also. It is the first branch of the cavernous part of internal carotid. One comes out of the cerebral part of internal carotid. I'm sorry. First branch of the cerebral part of internal carotid. And then the remaining branches you already know. Like it continues as middle cerebral artery. It gives off anterior cerebral artery. It also gives off anterior choroidal artery. Anterior choroidal artery, and it also gives off this posterior communicating artery. Just be careful about this posterior communicating, because when you see the circle of Willis, this thought might come to your mind that posterior communicating is a branch of posterior cerebral. No, it's not. It is a branch of internal carotid which is joining with the posterior cerebral. So these are the branches from the internal carotid. The fourth part, the first branch is very important. That first branch is the ophthalmic artery, and then it forms the circle of Willis by all these other branches. Now, knowing all these three major arteries, the vertebral, the basilar, and the internal carotid, let us also talk about that which area of the cerebral hemisphere these arteries are predominantly supplying. We already had an idea about that thing when we talked about the homunculus, but let us also see this thing separately. So there we go, guys. When you see the superolateral surface of the brain, and let's say when you see the medial surface of the brain, let's find out what are the dominant arteries there. Now, if you leave a thin strip along the upper border and this occipital lobe, then what you will see, the dominant artery which is supplying the superior lateral surface of the brain here, this one, the dominant artery supplying the superior lateral surface of the brain is the middle cerebral artery, the artery which was running in the Sylvian cistern. This was a Sylvian cistern, and that's the main artery here. This area along the upper border that is supplied by the anterior cerebral artery, whereas this occipital lobe along with the inferior part of the temporal lobe is taken care of by the posterior cerebral artery. That is the arterial dominance on the superolateral surface. Well, the things are a bit different when you see it on the medial surface, because on the medial surface, the dominant artery on the medial surface, including the corpus callosum part, is the anterior cerebral artery this time. The anterior cerebral artery is the dominant artery of the medial surface of the brain. You can actually appreciate the anterior cerebral artery forming the superior relation of corpus callosum also. This is anterior cerebral artery, which you can see passing, it is running above the corpus callosum. Middle cerebral was where? Middle cerebral was in the Sylvian system. That's the site for the middle cerebral artery. Anterior cerebral can be appreciated forming the superior or the upper relation of corpus callosum. Then we have this large posterior part, that is the occipital region, that is supplied by the posterior cerebral artery. Use a different color here. That is the posterior cerebral artery here. Whereas middle cerebral artery will supply the most anterior part of the temporal lobe, can be appreciated from the medial as well as from the inferior aspect. This is the middle cerebral artery. So clearly, when you talk about the arterial dominance, occipital lobe, the dominant artery is PCA. Medial surface, the dominant artery is the ACA. Superolateral surface, the dominant artery is the MCA, the middle cerebral artery. So this is about the blood supply of the brain. So guys, before we conclude this thing, let us also talk about the types of the intracranial hemorrhages. Types of hemorrhages. So these are the direct questions which are asked in the exam, like the extradural hemorrhage. What is the blood vessel involved in the extradural hemorrhage? And artery involved in the extradural hemorrhage is the middle meningeal artery. More precisely, it's the anterior division of middle meningeal artery, because that is the one which is going close to the pterion here. So it's the anterior division of middle meningeal artery, which goes close to the pterion, is the one which is involved in this extradural hemorrhage. Then subdural hemorrhage, the blood vessel involved in the subdural hemorrhage, it is usually by the involvement of the superior cerebral vein. This is also called as the bridging vein. Also called as a bridging vein. Bridging veins, the veins which are bridging the dural venous sinus, that is called as bridging vein. So superior cerebral vein is the one commonly involved in the subdural hemorrhage. Then we got this intracerebral hemorrhage. When you say intracerebral hemorrhage, that is usually because of the rupture of the berry aneurysm. Rupture of the berry aneurysm. Number 3 is the subarachnoid hemorrhage. Subarachnoid hemorrhage is usually because of the rupture of the berry aneurysm. It's the rupture of the berry aneurysm. And finally, the intracerebral hemorrhage, that is by the Charcot's artery or the lenticulostriate artery. We also call it the artery of cerebral hemorrhage. That is the intracerebral hemorrhage. Intracerebral hemorrhage. And that, as we said, is because of the Charcot's artery, also called as lenticulostriate artery or the artery of cerebral hemorrhage. Artery of cerebral hemorrhage. What was the artery of cerebral thrombosis? That was anterocoroidal artery, artery of cerebral thrombosis. This is the artery of cerebral hemorrhage. So this is about the blood supply of the brain. And with that, we conclude this portion here. I hope you understood the concept. I hope you can apply them in the questions. And with the combination of certain topics that we discussed in the head and neck part, that is cranial nerve nuclei, all the cranial nerves, and then all these topics, even the dural venous sinus is there, and then all these topics of the neuro will definitely help you to crack the questions of no matter any exam you talk about.